almost live. It's loading. Okay, we're live. Awesome. Cool. All right, perfect. Okay, so hello everybody. Welcome back to Staying Connected. And today we have two very special guests with us today. We're joined by Healthwatch. So, guys, if you wouldn't mind introducing yourself.
Yeah, I'm Anna. I'm the two roles at the moment. I'm kind of doing engagement coordinator as my main role, but our manager is on secondment at the moment, so I'm also leading the project.
Fantastic.
My name's Wendy Hadlington. I'm an engagement officer at Healthwatch Sunderland.
Awesome, perfect. So, how are you guys today then? How's everything going?
All good, yeah.
Perfect.
Fine.
Perfect.
Yeah.
Happy to hear it. Okay, awesome. So if you guys wouldn't mind, could you please just for our viewers, could you kind of tell us a little bit about Healthwatch, about like what you guys are as an organization and what your offer is, if that's okay?
Yeah, best way to describe it is we are an independent watchdog for health and social care services. So when we talk about health and social care, with the health, we mean anything that's branded up with the NHS badge, and social care is the publicly funded social care. So that's things like your care homes, care in your home,
Yeah.
anything to do with social work. And basically, the best way to sort of explain our role as the engagement team is we go out and about in the community, not so much at the moment though, to engage with service users and patients to find out how services are working for them, so whether it's good, bad or indifferent.
Yeah.
And with that information, we can then go back to those key people within the services, the key decision makers, to explain what people's experiences are, so that they can either build on good practice, so if it's good feedback, or if it's not so good, they can actually put things in place to improve services for people. Fantastic. So we're very independent. We are funded through sort of central government, but they don't dictate what we do. We kind of gather the data to dictate our work plan, as we call it.
Cracking, yeah, that sounds awesome.
Does that make sense?
Yes, it does make sense. So that's really cool. So how long have you guys been going for? Have you guys been up for a while? And is it mainly kind of Sunderland that you work in, or what is the kind of boundaries of like the area? Is it like Sunderland and Washington, or like what's the general kind of area?
Well, I'll let you answer this one, Wendy.
Right, how long have we been going though, Anna?
Originally set up in, I think, because we haven't been there since the sort of outset, but I think it was set up in around 2005, and it had a slightly different sort of remit. It was called Link in those days, and then it changed over to Healthwatch.
Oh, okay.
So it's been around quite a while. I've worked there for 4 years, and Wendy just under, haven't you?
Yeah, so about 3.5 years. And we cover the whole of Sunderland, including Washington, the coalfield areas.
Awesome.
So yeah, we would get out and about right across those areas. I think the furthest we've been is the edge of fence houses, just before the border into County Durham.
Yeah.
That's so cool. Yeah, so guys, I wanted to ask, general question here. So what's like a typical day for you guys at work? Like what would kind of be, obviously I know you've both got like different job roles, so it would be different somewhat for both of you guys, but if you could kind of just tell me what would be like a typical day. Maybe we should start with like pre-COVID. What would be a typical day?
Yeah.
Because it's going to be quite different.
Totally different. Yeah. So pre-COVID, I would head up the engagement team. So there's myself, Wendy, and then another lady, Audrey, who works with us. And we are the team that kind of go out. We're supported by a brilliant group of volunteers as well, who are our Healthwatch champions, their role title. And basically what we do is we're out and about. So anywhere that'll have us. So it could be leisure centres, GP practices, hospital waiting rooms, community centres, groups, that kind of thing. We go along and talk to people and gather feedback that way. So very, very much out in the community, because that's where the people are.
Yeah.
So that was our typical-ish day. We do a lot of work in care homes as well. So we visit all 7 care homes that there is in Sunderland.
Wow.
And we do that on a sort of a 12 to 18 month basis. We get round each care home. We spend a good couple of hours in the care homes talking to the residents, the family, friends and staff. So that's a big project that we do as well, which we love. So that's pre-COVID. Post-COVID, all of that stopped. Absolutely everything of that. Obviously, we can't sit in hospital waiting rooms. We can't go to GP practices. Certainly can't go into any care homes. So our work has massively, massively changed. And a typical day now kind of looks like this. So it's a lot of Zoom and Teams engagement. And we're quite good at gate crashing other people's groups. We just sort of invite ourselves along. So if there's coffee mornings going or groups are meeting, we try and see if we can get an invite to go along, and that's the way that we can engage with people in a safe environment.
And we're always looking for new groups. So if there's anybody out there who knows of a group or is part of a group and want us to come along and have a chat about health and social care services, or just to tell them what we do, we'd love to come along. That'd be fantastic.
Yeah, because one of the things I have forgot to mention, as well as collecting people's experiences and feedback, we also have an information and signposting service. So this is basically if anyone's got any questions about health and social care, and it's a minefield, especially at the moment, you know, it's like constantly on the news. That service is there for people. So we often, when we go to groups and talk to people, they might have a question or want to know how to make a complaint, or they might be having trouble with a GP practice, getting an appointment, they can ask us. We don't directly deal with that, but we can signpost them to where they can get their answers. So we can kind of navigate them through the health and social care sector, which is huge, absolutely huge. So
sometimes just by sitting with somebody and having a chat about the services they use, we pick up on the fact that they need further support, or we know an organisation that can help them with a certain issue. So we definitely miss that at the moment, you know, that face-to-face interaction. So if, you know, I'll reiterate, if anybody wants to come along to their groups, you know, I won't just talk to people, just have a chat. There's, you know, there's always something that comes out of it.
Yeah, and I'm sure that there's a lot of people that are going to attest for that. We've got Sunderland People First who are in the chat at the moment, and they said, we love the team at Healthwatch Sunderland. They do an amazing job. So there you go, guys.
Awesome.
And so, yeah, Haven mentioned there that my mic was a bit quiet. Obviously, you guys mentioned that just before. I wondered if it's any better there. I was just kind of trying not to be too distracted, but I was fiddling on the background there, trying to test my mic through Zoom. So hopefully that might have fixed it a little bit, and I've adjusted the volume a bit in the streaming software as well. Okie dokie, so let's have a look. And yeah, Sunderland People First said that you have to give the team full marks for the way that they respond so productively to feedback and actions. So that's some more praise there, which is pretty cool.
We paid them well.
We did. Well, Sunderland People First are a really good example of how we're engaging online and how you know, we can make a difference by being within a group situation, even if it is online, because we have regular meetings with Sunderland People First where the people who come along can just talk openly about using health and social care services. And from that, we've picked up on things that we've been able to take that little bit further, be able to do some signposting. Or for instance, we're working at the moment with the Queen Elizabeth Hospital to try and get an easy read letter put together for people women who go for a mammogram, but then they get called back into hospital because there's an issue. And they had easy read letters in place for every other point, apart from a lady who needs recalling back into hospital. So that came out of that conversation. I've got it in my diary to follow that up with the Queen Elizabeth on Monday, because that issue has gone to a big strategic meeting. So I'm phoning to find out the outcome on Monday. So that's a really good example of how that partnership working and just getting in a group and having those conversations work.
Definitely, and I think that it's important that there is someone there, or there is an organisation there which kind of can operate in the middle, instead of,
Yeah.
these groups having to go directly to, people like that. It could be quite difficult for that organization. So if there's someone in the middle who can assist that, I think it kind of makes the whole process a lot more streamlined as a whole, really, and just kind of
Yeah.
helps to ensure that, organizations can, in this case, be as inclusive as possible, and things like that, which I think is really, really important.
Yeah, and a lot of
Yeah.
these key decision makers as well, so that, the NHS or social care council, that kind of thing, they do understand who we are and what we do as well, so they do listen to us now as well. We've kind of built our credibility up to now where they actually come to us. So the clinical commissioning group, which is part of the NHS, are now coming to us around a piece of work that they're doing around mental health and setting up their new strategy and their new work plan for mental health. So they're actually utilising us to do that because they've seen the benefit of us, and we've got the links in the community that they haven't got. So we know we can go to groups and just say, tell us what you think, etc. So we're getting straight to the heart of, the community.
Yeah.
And they're not quite there yet. So
I think that's a really good point, Anna, as well, because I think that a lot of these kind of groups, as you mentioned, they may want to kind of offer that feedback, but
Yeah.
they don't have the resources, perhaps, right? Or they don't have the same connection. So obviously, as you're saying, with you kind of being more, having more kind of connections and more resources available, if they tell it to you, then you're able to kind of actually, more effectively give feedback, or you're able to, who to contact, for example, or what the best steps will be next, which I think is really important.
Yeah, we can hold them to account as well. We have sort of certain statutory powers where they have to respond to us as well. So we're very good at sort of knocking on doors and saying you must respond to us and you have to justify, so which is good. I mean, we don't like to use those because we hope they've got enough respect to do it, because it's the people who they're serving at the end of the day. It's their patients, their service users. So, but it's there if we need it.
Awesome. Well, and that's obviously great. It's good to have that security as well, though, right? So
yeah, and obviously the more feedback we gather about a certain subject, the more clout it has, the more people having their voices heard.
Definitely. Yeah, that's a really good point too, I think so. And that's obviously massively important too. So yeah, obviously just to kind of say, like, in general, Anna kind of mentioned about the general kind of ongoings and what a day would be with her. How about for yourself, Wendy? Is your day generally quite similar to Anna's, or is it quite different in a way, or?
Go to a lot less strategic meetings than Anna, so I would do more of I'm lucky. I would do more of the the meetings with groups, and sort of the more sort of grassroots level, so meeting with just the general public, and so I've got it a little bit easier. As I say, I'll go to one or two meetings maybe to cover for Anna, or she's got two things in her diary at the same time. But I do less of the strategic, definitely, and more of the fun stuff. But very much sitting in this room, in front of my computer a lot of the time, which is so different.
Yeah. So yeah, I kind of want to kind of ask a little bit more about that. How obviously I asked this question to most of our guests, but how was it for you? How was the change for you guys initially? Because obviously when COVID hit, it changed everything for all providers, really, and all kind of organizations. So what kind of things did you have to do next to kind of be able to kind of adapt to that? I'm imagining, it's really funny because we often joke that, like, most of the country all learned how to use Zoom. It was something that, like, no one had even heard of before the coronavirus, but now everyone knows how to use it. So yeah, what were the measures that you kind of put in place to be able to continue, working, really?
I just think, like everybody, isn't it? It was kind of one day you're in your office, the next day you sat at home and kind of like, what do I do now type thing. So we did sort of feel our way for a good few sort of weeks, didn't we? And it took us a while even to get onto Zoom, and then, the technology, and some of us are better than others and that kind of thing. So just
some of our internet connections even, isn't it, Anna? Some of us have got better internet connections than other team members, and And how do you train a team when you're not helping them, you know, or you're not showing them something on the screen or on the keyboard? So it was very, very different, and it took a while to get used to working in that different way. It's still taking a while.
So, yeah, as a more kind of general question, how do you guys feel about the change? You know, is it do you find that it's more difficult for you guys, or do you find it, you know, enjoyable in some respects, or how do you kind of feel about it in general? You're not a fan?
No, I hate it. I do. You know, I love it when I'm having a Zoom session or I'm in a Teams meeting or whatever, but I'm a very
she's a social butterfly.
Right.
Yeah. I'm a social butterfly. I'm in engagement because I love to engage with people. I like nothing better than sitting down with somebody, having a chat and feeling as though I'm supporting them in some way. So I'm finding it very difficult. Have good days and bad days, good weeks and bad weeks. But I'm still struggling and really look forward to the day when we can get back in the office and back out into the community.
Of course, yeah. Is it about the same for yourself, Anna, or do you have a slightly different thoughts? Or?
I would say I'm probably faring the best out of the whole team, to be honest. Yeah, I don't know why. I do miss being out there, though. It was a novelty at the beginning, you know, and everyone was still like in that weird phase where it's like this isn't quite real type thing, and it's starting to sort of Groundhog Day starting to kick in a bit now. Very much so. I do the same thing at the same times, and it's like and I want to get away from this dining room table very much.
Yeah, I can understand.
Yeah,
I actually watched that film like a couple of days ago, so it's interesting that you said that. It's quite funny, but great classic movie. But no, I can relate to that. That's a fair observation, I think. Yeah, guys, so you mentioned a little bit about, you know, coffee mornings. So I think that's something that's really good, you know, just as a more kind of, you know, general way just to kind of touch base with different organizations and just to see how things are going. How did you kind of devise that idea and you know, how did you get involved with it, really?
I can't remember how it came. I mean, it's something that we've done all the time, isn't it? But then we started to sort of, we worked in the voluntary community sector for a long time between us, and, you know, this job, various other jobs, that kind of thing. So we've got quite a good understanding of all the groups that are out there at the moment. So just getting in touch with, you know, the staff within them and saying, you know, what are you doing? Is there anything we can engage with? So Wendy's done the Essence services, quite a good link that we've made as well at the moment. We did a campaign last week around self-care. So last week was self-care week. So we did a week-long campaign around that, just raising awareness of self-care. So we did a session with Sunderland People First, the Essence Service, and Headway Wearside. So we went along to their groups, sort of a gate crash, went along, invited ourselves along, did quizzes with them, tried to make it a fun activity as well, so it's not just sort of preaching. So yeah, it's just been a bit more creative with the way that we do things, and we've never done a week-long campaign like that before as well, so that was quite new to us. And another area that we also started was we invited a lady from the Cancer Alliance. Is that right, Wendy?
Yeah, Northern Cancer Alliance.
Jo McIntosh, who did a session on signs of cancer and how to keep yourself right and what to do if you do find things. So that was a one that was open to the public, and it went really well. So we're hoping to replicate that. And I think with technology as well, people who wouldn't necessarily have come to a face-to-face meeting might start engaging online. But you do also miss those who aren't on technology, you know, on over technology online, that kind. So it swings and roundabouts, isn't it? You'll hit some audiences but not other. So that's something we're going to maybe, you know, once we are back out in the community, it might be a combination of the two, and I think everybody's learned that.
Yeah, I think that's been a good thing as well, though, talking about technology. Some of our volunteers wouldn't have dreamt of going, you know, online to a meeting or something, but with a little bit of, you know, telephone training, a little bit of coaxing, they're there, they're on, you know, and they're enjoying it, they're getting a lot out of it. And, you know, some of our volunteers are not getting out much because, you know, the shading themselves, looking after their health. So that's been beneficial for them as well. And they've been able to do little bits of work with us as well because they've been able to get online.
Yeah. I think that there, you know, some really great points mentioned there. And I think that, as you were saying there as well, Anna, like, it's interesting, isn't it? Because in one respect, it's good because people who may not have been able to attend certain sessions, you know, just because maybe they're not as mobile or they just couldn't have made it, you know, they're able to do it from a distance, which is fantastic. But then, as you also mentioned, at the same time, it's also affecting a certain group because if they're not digitally like savvy, right, they're not maybe able to get online and do it. So that there's, you know, the positive aspect being that it's, you know, there's more accessibility, but then there's also certain people that can't access it, which is tough. But as you were saying, Wendy, I think that's very true. You know, there's been a lot more upscaling of skills in terms of, you know, communication. And I think that a lot of people that maybe you've never really engaged with a computer or a tablet at all are now able to use Zoom. Like quite a lot of people actually. So I think that's also quite a good thing.
Definitely, yeah.
I think just having a chat as well and seeing some different faces. Exactly. You know, I think it does us all good, doesn't it? Even if it is virtual.
100%. Yeah, no, you're totally right. I think that's quite important. Actually, that some of the people first mentioned as well. It was interesting that you were saying that, Anna, because they were saying that they loved the self-care quiz with the team at Healthwatch, and they were saying that you know, it was really open and honest conversations, and they were saying that you know, that that they were saying in general that they miss like kind of face-to-face stuff instead of Zoom. And so some of the people first have a question here. They say, Daniel, can you ask Anna or Wendy whether they plan to take any more team photos on a climbing wall?
It's a good job that Andy's not here. He'd be sharing that, wouldn't he?
I know. Yeah. Are you aware of this, Daniel?
No, I'm not actually. This is news to me.
I'm very surprised because he shares this photograph with everybody.
Okay.
I don't know how he managed it, but it was at one of our volunteer celebration events. So we do events every year, one in June through Volunteers Week and one at Christmas. And this was a June one, wasn't it?
It was the June one, yeah.
And because we're based at the university, we had it at one of their buildings, the campus at Chester Road, which has a climbing wall. So Andy took us to show us this climbing wall. So myself, Wendy, don't know what possessed us, and our manager who's on secondment at the moment decided to climb up the wall. None of us were dressed appropriately. We all had sandals on. And he took a photograph of us halfway up this wall, apart from I am quite tall, but I'm not that tall. So the actual photograph is totally out of proportion. So I look like the Jolly Green Giant, and Wendy and Margaret look like little imps, don't you?
We do. We're tiny and Anna's massive.
Yes. So Andy gets this out at every opportunity to embarrass us.
He does.
Well, I'm sure it's obviously to do with...
I don't know whether you can hear that. That's one of the joys of working from home. I've got a dog scratching on the door, so I'm just going to open it. Two ticks.
Let them in. No, but I'm sure that's partly to do with perspective as well, right? So obviously, if one of you is closer to the camera or further away, it's gonna kind of create that illusion.
Yeah.
That's quite funny there.
It's a classic. Andy gets that photograph out every opportunity he can.
No, but I think that's awesome. So just kind of want to ask you guys as well, what is the local offer looking like at the moment? And I know that, so just is there any kind of thing you guys have got for that? Like what's the general like kind of offer at the moment? I know we've kind of touched on some of this stuff, but
yeah. So basically, what we can offer local people is first and foremost will be our information and signposting service. So we've got lots of capacity within that. So anyone has any questions about health or social care, give us a call. It can be anything, absolutely anything. And if we don't know straight away, we'll find out. And that works really well. feedback from people about any services that they've used, good, bad and indifferent. And like Wendy said, the more intelligence we collect, the greater the voice is. So it's all about patient voice, service user voice. And we are looking for volunteers as well. Obviously, the volunteering opportunities are completely different to what they were once. And, you know, people will be doing things virtually. But there is things that they can get involved in, and in particular we would love to hear from some young people who want to get involved as volunteers. So that's something we're going to be working on in the new year. Once I go back full-time to my original role, I have volunteering within my role, so I'm going to try and concentrate on getting a young, like a youth volunteer project up and running as well. So any young people, you know, it could be for work placements, university placements, that kind of thing, we can offer them. And it's a good opportunity, because if you're thinking of going into health and social care but you're not sure what discipline to go into, we cover the whole spectrum.
Awesome.
So it's a trial and error. I always say use it as a trial and error. You could think you want to go and work with older people and try it, not like it, and at least you haven't kind of gone down a 4-year degree and wasted, you know, and then discover at the end of it with X amount of money, you know, in debt, that kind of thing. Try before you buy, and we can tailor people's volunteering opportunities to their likes and dislikes as well, which we do with a lot of our volunteers. We kind of build on their strengths and build up, you know, skills that they're interested in gaining at the same time as well. It's very bespoke.
And they can do as much or as little as they like. You know, we don't have, you must do so many hours a week to stay with us. It works around their lives, and they can basically pick and choose what they want to do, as Anna said. So if we're going into a doctor's surgery, for example, once we're out and about, you know, we'll put that out to the volunteers, and if they're interested, they get back to us. You know, we could be going to a care home. If they're interested, they get back to us. So it's very much what they want to do and when they want to do it, really.
I think that seems, you know, invaluable, really, and especially because, you know, you're able to kind of cater it to them so well. It seems like just, you know, an amazing opportunity all around, I think. So, so I've put a link in the chat to the website. Oh, and then Haytham has put it underneath a clickable link, which is perfect. So there you go, guys. If you're interested, you can check out the website, and I'm guessing on the website you can see, right?
And you know, from there you can also get to our Twitter and Facebook pages, because a lot of information is shared obviously through social media, and we have a newsletter that goes out more regularly these days. We used to do it monthly when we were in the office. When the COVID pandemic first started, we started doing them weekly, because obviously there was lots of information. They tend to be more or less every other week now. So we normally do a top 6. So top 6, you know, focusing on a theme normally. Top 6 around COVID, top 6 around health and well-being, you know, depending on what the theme is. But we don't bombard people with emails. We only put something out if we've got something that needs to be shared.
Fantastic. Yeah, guys, so if you want to sign up to the newsletter as well, then make sure to check that out. It seems awesome. And Haytham has just shared a link to the Facebook page there as well. So give that a click, guys, and have a little look. Awesome. And so we had a question from one of our learners, and I'm not sure really how much you can say about this, but she was just curious. I think she was saying that can you ask the ladies how much of an increase in mental health issues that they've seen since March? And I think I'd imagine it's obviously been quite a bit, just considering how much of an impact that the pandemic has had on everybody's lives, I'd imagine. So
we did a massive survey throughout June, and it was COVID related, so it asked people a range of questions about, you know, the whole COVID impact in sort of the initial phase 1, lockdown 1, all that. Obviously things have changed slightly again, but I would say, can't remember the exact statistics that came out of our survey, but a lot of people were impacted, either moderately or greatly by the pandemic. And to be honest, I think as time's gone on, I think the majority of people will admit that, you know, it's impacted them in some way or other. And that's why I think the NHS through the CCG are actually looking at redesigning their services that they are offering. So CCG fund a lot of the community-based mental health work that takes place. And they want to make sure that what is on offer is actually fit for purpose. So does it actually, you know, cater to the needs of people who need the services? And we know prior to COVID, it really wasn't hitting the mark. So there was lots of people on waiting lists, and obviously it's just been compounded by what's happening at the moment. So hopefully through the work that we're doing with them at the minute, and that runs up until January. So that link to that survey, if people want to give their feedback, is going to be available from Monday. So we'll be sending that out. It'll be on our website, newsletter, socials, etc. And you know, it's important that people kind of feed back into that to make sure that services in the future are going to actually be there for the people who need them.
Definitely.
But I think
even if you haven't been impacted yourself, you know, think about your friends and family and how they've been impacted. And just because you haven't been impacted now, the changes do also consider older people's services and how they're going to look. You know, we never know in the future if we're going to need services. So it's well worth getting involved to make sure the services in Sunderland are the best they can be from what the people of Sunderland have said.
Yeah, 100%. But it's about the soft things as well, because I've had a quick look at there, because we've got a copy of the survey that's going out. It's about the things people do to keep themselves well, you know. So I like my exercise, that makes me feel good, taking the dog for a walk. So it's about the local offer as well, what else they can put in, you know, for people's just general health and well-being, and what additional services. So there used to be things like exercise on prescription, you used to be able to go to Weight Watchers through your GP, and used to get a referral for that kind of thing. So there's that also that they're going to be considering as well, rather than, you know, the sort of services that are kind of once you're feeling down. It's about keeping yourself well before that happens.
Yeah, no, exactly. And I think that's important as well, because I think that can often be forgotten about, right? It's like, you know, I think obviously it's important to help people when it's got to that stage, but, you know, maintaining it beforehand, I think that's also very important. And maybe it's not really talked about too much. So I think that's a really good point.
Yeah, I know in Self-Care Week, we spoke to quite a few people about what they're doing at the moment to keep themselves well, but how that has changed over the past few months, and what different things they are doing. And a lot of people were talking to us about how they've adapted and trying new things, which, you know, it's great.
Of course, definitely. And I think that's another really good point too. So, you guys mentioned there as well, like how can people get involved or support you? And I think we obviously mentioned that the website, right? And then on that, which will link to some of the other socials, and we posted the Facebook in there as well. So yeah, I'm just going to double check with the chat, see if we've got anything else going on. I think that's pretty much, I think that, hold on. Yeah, so if that seems good. And some of the people in the chat, Wibbs is just saying thank you very much, guys, for coming on today. He's saying that's great. And yeah, that's looking good. I think that's about pretty much, we're almost done, I think, guys. Is there anything else that you guys would like to add at all? Is there anything else you'd like to mention?
No, not for me.
No, I just think if anybody has any questions or they're unsure about anything relating to health and social care, they can just get in contact with us. You know, go on the website, go to the contact us page, phone number and email, and everything's there. We'll be more than willing to answer their questions.
Perfect. Awesome. Well, yeah, good. I'll just give people in the chat 1 more minute, guys. If you guys have got any more questions just before we go, please get them in. But otherwise, so I'll give you guys just a little chance to get some questions in there. And yeah, people in the chat are saying great session. But otherwise, thank you guys for coming on. Really appreciate it, Wendy and Anna. And yeah, it's been a great, very insightful session. So I really appreciate it, guys. Cool. And we've got one more question from some of the people first. So they asked, Daniel, can you ask Wendy if she would be prepared to do her rendition of the 12 Days of Christmas here? So
No.
No.
Not until I've got my Christmas tree up. Then I'll be singing it all day long.
Okay, perfect. Awesome. Great, cool. So we can look forward to that. All right, thanks. I think that about does it, guys. Thank you for coming on today, guys. And yeah, thank you for everybody tuning in. We had a lot of engagement in the chat today, and I think we had quite a few people viewing the session, so that's absolutely perfect. But yeah, thanks a lot, guys. And I think that is about it. I am just going to put some of our advice lines up in the outro, and then we are going to go. But thank you for everybody tuning in. Much appreciated, guys. And yeah, I hope everybody has a good weekend. So see you later, guys. Thank you for tuning in today. And thank
Thanks. Bye.
you to Anna and Wendy.
Bye.
Guys. Okie dokie. All right. Cool.